if you have been asking yourself, what is progesterone hormone? What is the role of estrogen and progesterone in the menstrual cycle? In this live session, I'm going to talk about this. So if you have been asking yourself about progesterone, you want to know something about progesterone, you want to know something about estrogen and what they play in the menstrual cycle, then in this live session, I'm talking about all this. This live session is going to be in two languages, the English language, the Luganda language. Ngenda kwogera ku mugaso ki ogwa hormone gye bayise estrogen, mugaso ki ogwa hormone gye bayise progesterone. Bw'obanga obadde weebuuza estrogen hormone ekola ki, progesterone hormone ekola ki, mweno live session ndi kuddamu kino ekibuuzo. So estrogen hormone, first of all, very important hormone. It is a hormone that comes as a result of changes that are taking place in a woman's body. As the eggs are growing, as the woman's eggs are growing, there's going to be production or there's going to be release of the estrogen hormone. Amagi g'omukyala bwe gaba gali kkula wagenda kubeerawo ebitekinga place omuli okuba nti hormone gye bayise estrogen egenda kuba. The main function of estrogen hormone is basically to prepare the uterus, to prepare the womb in preparation for the changes that are going to take place. Estrogen specifically leads to growth of the cells of the uterus, and then of course it prepares the uterus for what is going to happen. In other words, the estrogen hormone prepares the uterus for the incoming baby. If pregnancy happens, then estrogen will continue rising. But if pregnancy does not happen, then estrogen could actually reduce and then a woman will see her periods. Wabanga obadde oli kwebuuza mugaso ki ogwa estrogen, then estrogen kyakola specifically ategeka n'abaana okulaba nti n'abaana eno esobola okuba nga esitula omwana. So the first role of estrogen is basically it brings about the growth of a womb, or it brings about the normal preparation of the uterus of a woman. Kwebuuza estrogen hormone ekola ki? Function esooka, estrogen hormone etegeka mu n'abaana okulaba nti at least omwana wabazze abeera ne waba agenda okuba nga akulira. Progesterone hormone is also another hormone that is very important in the system of a woman. Hormone gye bayise progesterone nayo nnungi nnyo mu system ey'omukyala. Progesterone hormone specifically, it brings about that whole process of implantation. Basically, it supports the whole process of implantation. When the baby attaches onto, when the fertilized egg attaches itself onto the wall of a woman's womb, it is this hormone known as progesterone that actually supports this whole process. It actually goes on to maintain the pregnancy up to the 9 months. When the 9 months reach like this, then the levels of progesterone are going to reduce and then the woman can give birth. Progesterone hormone specifically eyambako ennyo okulaba nti omwana ono yeekwata ku kisenge ky'abaana, era wabanga abadde yeekutte ku kisenge ky'abaana eyambako ennyo okulaba nti omwana ono asigala ku kisenge ky'abaana okumala emyezi 9. If you have been asking yourself what could be the main function of progesterone hormone, basically it supports implantation, attachment of the fertilized egg onto your uterus. It also supports the whole process. It supports the pregnancy up to 9 months. So the main role of progesterone hormone in the menstrual cycle, specifically estrogen, prepares the uterus. It enables the uterus to grow, to have its normal layers. That is the outer layer, then of course the middle layer, and then the innermost layer. And then function eya estrogen specifically etegeka n'abaana neraba nti at least n'abaana nebeera ready okubanga egenda kusitula omwana. And then progesterone hormone eyambako ennyo okulaba nti at least omwana waba yeekutte ku kisenge ky'abaana agenda kukula okumala emyezi 9. Okay, so if you have any questions, you can actually ask your questions in the comments. I'll be able to reply to all your questions. If you have any questions in regards to the role of estrogen, the role of progesterone, you can ask your questions in the comments. I'll be able to answer all your questions. Now, I'm going to talk about what could happen when the levels of estrogen hormone are high. What could happen when the levels of progesterone hormone are low? Or what could happen when everything is vice versa. Ngenda kwogera kati ku ekibuuzo ekirala ekibuuziddwa ennyo mikono gyaffe n'agamba nti yakola test eya hormones oba yakola fertility hormonal test ne bamugamba nti alina estrogen naye nga mungi nnyo, alina estrogen hormone nga nyingi nnyo, and then of course alina ne progesterone hormone nga ate nayo ntono nnyo. Ali kwebuuza kino kiba kitegeeza ki? What could happen when your estrogen hormonal levels are high, and then what could happen when your progesterone hormonal levels are low? This is what I'm going to talk about. When estrogen hormone is rising, when estrogen hormone has taken over progesterone, in other words, when the levels of estrogen hormone are much more higher than your progesterone hormone, what is going to happen is that there's going to be changes that will take place. These can actually be due to the levels of estrogen rising. These changes include irregular periods. A woman could experience irregular periods when estrogen is very high. A woman could actually experience mood changes, and then also a woman could experience issues with getting pregnant, difficulty in getting pregnant. Biki ebisobola okutuukawo omukyala wabanga abadde azuuliddwa nti levels ze eza hormone gye bayise estrogen nga eri waggulu nnyo, and then progesterone hormone nebanga ntono nnyo. Omukyala ekisookera ddala agenda kufuna obuzibu okubanga afuna olubuto amangu kuba estrogen hormone eba erinnye nga nyingi nnyo. Ekirala kiri nti omukyala aba asobola okubanga ate afuna challenges n'okubanga afuna kye tuyise normal ovulation, abata ovulating bulungi kulw'okuba estrogen hormone eba eri waggulu nnyo. So the changes that could happen when a woman's estrogen hormonal levels are high, there's going to be actually increased difficulties in having normal periods, difficulties having or undergoing ovulation, and then there's also going to be other changes that could happen. What could be among the most common causes of high estrogen? Biki ebisobola okubanga bireetera hormone eno gye bayise estrogen okubanga nyingi nnyo? The first reason as to why